Is making news on your headlines today, and also discuss issues a bit deeper. Today it's all about marginalization and empowerment. How far are we on that? Is BBI the cure in that particular situation as well? We'll have that discussion in studio. Have a very able panel to take us through that particular discussion. But right now, as always, let's look at the front pages of the dailies, see what you're waking up to as you grab your copies of your newspapers. Front page of the People Daily. COVID reality strikes home. They're calling it a wake-up call. Nyeri Catholic Archbishop Anthony Moheria is the latest high-profile person to contract the deadly virus which is ravaging the country, infecting and killing people regardless of their station in life. As you can see right there on the front section of your paper, Anthony Moheria, Archbishop Nyeri, Dr. Patrick Amoth, Acting Director General for Health, also having been infected by COVID-19. And also some of the virus victims right there: Justice Maranga, MP Matungu constituency, Mohammed Hatimi, former KFF chairman, and Dr. Jacqueline Jeroge of the Thika Level 5 hospital. So of course, just putting a face to what really is a pandemic that is ravaging not only the country but the entire world as well. This story is on page 6 of your People Daily today. Also on the front page of the PD, Uhuru Raila to launch collection of BBI signatures. Former Dagoretti South MP Dennis Owero and Minority Chief Whip Junet Mohammed to chair new secretariat. This is a story you can get on page 4 of your People Daily. The details of that are therein. Even as you look at that, also matters further afield. Obama's intimate view of the White House. Ex-president has pulled back the curtains of his former official residence for the world to see what it's like to hold the most powerful position on the globe. That story can be found on page 8 of your People Daily. And if you haven't gotten yourself a copy of your PD, you can also get it straight to your phone. The number that you dial is *550 *4#. Once again, the number is *550 *4#. Dial that number, get yourself a copy of your PD straight to your phone. It's brought to you by the People Daily and Safaricom. Front page of the Daily Nation now. School fees pinch in 4-term years. Only grade 4 and standard 8 will cover 3 terms next year. Lobby indicates it will petition the government to increase the free primary and secondary school cash allocation and negotiate a grace period for settling of fees arrears as a financial burden of 8 terms in 2 years hits home. And worse, Education Ministry pushes cost of complying with COVID-19 protocols to parents. So this really is salt to the injury on this one, even as it stands at this particular point in time. How we move forward as a country, of course, reeling from a battered economy, but trying to juggle the fact that trying to get these children back in school is really the big issue of concern. This story makes front and center in your copy of your Daily Nation. The details of that therein. Also in your copy of your Daily Nation, kingpins to lead campaigns in 14 blocks. This, of course, to do with matters BBI. Race to 4 million BBI signatures begins. As you can see right there, those who ostensibly will be at the helm of leading this particular process: Wycliffe Oparanya, Kakamega Governor Isaac Ruto, Amason Kingi, Dennis Owero as well. We also have Anne Waiguru and Maina Kamanda right there as key people of interest on this particular issue. That is a story you can get on page 4 of your Daily Nation this morning. Also on the front page of your Daily Nation, civil servants get enhanced medical cover. This is a story you can get on the back page of your Daily Nation, with the benefits that have now been extended, especially due to COVID-19. That story is in your copy of your Daily Nation. We move it right along to the front page of your Standard now. The wailing governor, they're calling him. A year ago, Nairobi County boss Mike Sonko was the baddest man in town, flaunting bling and billions with the machismo of a godfather. He boasted a direct line to the president, and City Hall was his playground for fantastical political and civic engagements. Then the phones stopped ringing, and Sonko went wild on social media, chasing shadows. This story can be found in your copy of your Standard, as they detail really where the rain started beating him. That is a story you can get on page 4 of your Standard today. Also in your Standard, Uhuru and Raila take BBI numbers war to Ruto. That's how they're calling it. Handshake leaders start referendum protocol with launch of signature collection tomorrow. Allies say they're targeting 5 million Kenyans to endorse their bid in a fresh wave of supremacy battle with the deputy president. That's a story that you can get on page 6 of your Standard this morning. Finally, from page of the Star, it's all about matters BBI. BBI clash. Uhuru Raila launched signature drive at this particular point in time. They're also talking about those who will be heading the secretariat: Janet Ongera, Sarah Mwiria, Junet Mohammed, and Dennis Owero, who will be leading that push. also calling it a showdown as it moves forward. Ruto, churches and civil society ready to oppose this particular referendum. This story can be found on page 4 and 5 of your Star this morning. And as we look at that also, just taking stock of what has been Nairobi's rehabilitation, the contrasting worlds of Nairobi metropolis, as you can see right there. The rehabilitated Mwindi Bingo Street in Nairobi and a heap of garbage on Imara Daima Mukuru kwa Jenga Road yesterday. So how far does this rehabilitation go? Does it visit all parts of the metropolis? As you can see right there. And this is an issue, of course, squarely in the docket of the Nairobi Metropolitan Service, and you can find that story in your copy of your Star this morning. So as you can see, really front pages of dailies this morning is matters COVID, education, and the launch of the BBI signatures. That is going to be making front and center. But even as we talk about the BBI and COVID-19, where is the question of women in this particular scenario, youth and people living with disabilities? Are they still marginalized even in this post-BBI, post-COVID world? It's a discussion we have on the show. Welcome to K24 this morning. And welcome back. And even as we do that, I have a very able panel to take us through this particular discussion. Also have a question of the day that we'll be posing to you. Of course, we love it when you give us your feedback, your comments, and your thoughts on the conversations we have in studio. You can get me at I am Jeff Motter or at K24 TV. Or on WhatsApp, our WhatsApp number at the bottom of the screen. And there's a question. Has the BBI captured the needs of women, youth, and people living with disabilities? Once again, has the BBI captured the needs of the women, youth, and people living with disabilities? Even as they head on and launch their signature drive, has it captured those aspirations, those needs of women, youth, and people living with disabilities? It's a discussion we have right here on the show, and we love it when you're part of it. Of course, once again, the WhatsApp number at the bottom of the screen. Let's get right to it, get to my panel as we discuss issues of the day. In studio, joined by Honorable Ole Sankok, nominated MP. Good morning, sir.
Morning to you, sir.
Welcome to the show.
I'm very fine, Jeff.
It has been a while.
Thank you. Yeah, it has been a while, but I'm always ready when you call me.
Is all well in Narok?
Everything is well. We have received some rains. And Jeff, I've always told me I'm always fine.
Okay. Fantastic.
Always.
Fantastic.
Always.
Welcome to the show. Asante sana for
Thank
making
you,
time.
thank you, sir.
Join the conversation virtually. We also have Kathiani MP, Honorable Robert Boy, who will be joining us virtually, and Dr. Pamela Odhiambo. She's a Migori County Women's Rep as well. Good morning, Honorable Robert and Dr. Pamela.
Yeah, morning.
Good morning to you.
Karibuni sana. Welcome to the show.
Asante.
Okay, fantastic. Let's get right to it, even as we start this particular discussion. I want us to look very briefly at the front pages that we're seeing right now, because even as we talk about launching of BBI signatures and moving forward, the cloud of COVID doesn't seem to be getting any lighter, Honorable Sankok. And even as it stands, some people are wondering, are we having misplaced priorities, even as a political class right now, looking for signatures instead of focusing on really what is biting everyone right now?
Among the very intelligent presenters, it is you, Jeff. Our priorities are totally upside down. We can collect 1 million signatures. We can have money to move around the country to collect 1 million signatures. Yet it becomes very difficult for us to trace a few characters who stole PPEs that were donated by Jack Mo, which will have gone a long way to protect our health care workers. Jeff, we can afford 14 billion for a referendum, but we cannot afford health insurance for our health workers. I'm telling you, we are losing health workers. And they are human beings, just like me and you, Jeff. They are living in fear. And if our health workers are living in fear, it's like you having a bodyguard who then, when there is commotion, you will be the first one to scream. What will happen to you? You will faint.
Right.
Now our health workers are screaming because they don't have protective PPEs, personal protective equipments. They are not insured. And yet, us as leaders, I have a comprehensive health insurance cover. My president, my deputy president, CSS, PSS, governors, everybody have a health insurance cover, a comprehensive one. Yet those whom we go for them to treat us are not covered. They are on their own. And even recently, the CES had the audacity to come to the public and tell Kenyans, as far as COVID-19 is concerned, you are on your own. Yet recently, we saw people who are lowering their own salary so that we can come together as a country and save the lower cadre of our citizens. We had philanthropies. We had donations from all over, but they have been stolen. Okay. So Jeff, our priorities, as you are rightly put it, they are upside down. And I'm telling you, as a healthcare professional, I will consult with my colleagues. It may be high time that we withdraw our services to the upper cadre. Let their fuel guzzlers, let their positions, let their insurance cover treat them. The doctors, nurses, and all healthcare workers will in this country be treating only hustlers and the lower cadre citizen of this country. Let me get to
take the conversation to Skype as well. Dr. Pamela, even as it stands right now, when you look at the realities of the day, yes, the political class might have access to the best healthcare, but this is also a very non-discriminatory on this particular issue. We have the late Justice Moronga passing on just very recently, and now we can see this disease does not discriminate at all. Is this the wake-up call the politicians need to sit and rethink what the priority is and put BBI in a hold and put all hands on deck as far as BBI is concerned and move on from that and look at how to deal with COVID-19 and the economy?
Jeff, good morning, and also allow me to say good morning to my colleagues on Sankok and on Boi there, and the nation at large. It should be understood there are some questions and some answers which sound good to the ear, but I think we are being far from being realistic. As we are talking here today, the colleagues of the Kina Sankok team keep shouting that much money is going to be used on BBI and even those signatures collection and what have you. To be honest, I am part of the BBI and I'm a real supporter. I don't know how much money have been given to even collect those signatures. What I know, the modality of even collecting those signatures is far from being that expensive, the way Sankok is putting it. The issue of priority and the issue of health is a serious concern to all of us as a nation. And I think when we are discussing the issue of COVID came in early this year and hit other nations late last year. There was no BBI, there was no signature collection, there was no nothing. And I think we saw the government of Kenya, led by President Uhuru Kenyatta, call upon every Kenyan, every ministry to bring all the monies that were there to tackle the disease. And that was done. And there has been a fight over it. Of course, there must be, if there are any shortfalls, we need to talk about that as Kenyans. But there have been money set aside for the COVID. I think all of us, led by President Uhuru Kenyatta himself, we've been calling for the protection of the Wananchi, especially the frontliners who are medical health workers. So when we are talking about issues, I don't like it normally when we mix issues here and there and we are not able to cut clean lines. I think what has been happening in the country is a concern to all of us. The COVID has taken many lives, and may God rest Mutunga's soul in peace. I don't even want us as politicians and as leaders to even more be serious and even discuss this thing just because one of us has died. Kenyans have died, even if they are small, they are Kenyans and we care about their lives. And this is why even yesterday in Parliament, all of us were saying we need our doctors protected. And we have been saying this all along from the very day one. So the issue of the BBI or even the collection of the signatures or that launching, I just don't know how much the team of Kina Sankok thinks it is costing. Every other time, President has been giving these national addresses, and just saying that from today onwards, we are going to collect signatures. I don't know how much that would cost, and therefore, I'm appealing, even as we start off this discussion, let us not veer off the point. The point all of us agree is there is the scourge, there is pandemic. All of us, small and big, need to be protected. We need health care, right from the president to the sweeper in the streets of Nairobi.
Okay, Dr. I hear you on this.
We don't need to neglect anyone. And I think that is my bottom line. And I want us to discuss this thing very maturely, knowing that much as the pandemic is going on, everything else in our lives as Kenyans cannot just come to abrupt standstill just because there is the pandemic. Every part of the world is actually struggling with it. And I think even in Kenya, what the president did by even moving vote heads from other ministries to come to the Ministry of Health so that this pandemic is fought was a whistle and an indication, and still remains thus, that health is being given the priority that it deserves.
Let me get Robert, Honorable Robert, in on this particular discussion as well. Very quickly, as you wrap this up and move to the issue of the day, Honorable Robert, Deputy President William Ruto said, I think 2 days ago, was it? The wave of COVID-19 is clearly ravaging our nation with alarming increases in infections and deaths. The pandemic is killing people, including health workers, while destroying livelihoods. We should stop everything and mobilize every human, material, and financial resource to fight this particular pandemic. Are we doing that, Honorable Robert? Or is it more politics?
Yeah. No, thank you, Jeff, for this opportunity. I also want to greet my colleagues, Honorable Sankok and Honorable Pamela. And I want to say first and foremost that this issue of COVID-19 is a real serious issue. In fact, the most unfortunate thing is that Kenyans have kind of veered from the understanding of the problem of COVID and started politicizing it. In fact, a lot of times, COVID is being used as a scapegoat in many issues. Now, I've listened to my colleague, the Honorable Sankok, and I'm shocked because Sankok here is telling us that, he would rally doctors not to treat leaders in this country, either members of parliament or the president or the ministers. And I'm shocked considering that he's saying this just a few days after we lost a colleague to this problem. I think we need to be serious. I want to agree with the Deputy President on one thing, that yes, Corona is a real issue and it's a major problem for this country. But I don't agree with him when he says stop everything. I mean, look, if he says stop everything, it means we stop going to work, we stop transporting people, we stop educating people, we stop feeding people, and that cannot happen. By the fact that we have one problem doesn't mean that other problems shouldn't be sorted out or other things shouldn't go on. So I want to say that life must go on. We as human beings are created with the resilience and the ability to withstand and to fight on. So I don't want to say that we should curl up and go under our blanket and die. Okay. We will fight this corona, but we will not stop doing other things because of corona. Okay.
Hear you on that. I want us to move this quickly forward because of we'll be coming back to COVID-19.
No, one minute.
10 seconds.
Okay. Thank you very much. And I really do respect Honorable Mbuyu. He's a very good friend of mine and Dr. Pamela. But you know, what the Deputy President said is that let us channel all our resources in fighting this particular pandemic, because the dead will not speak in their grave. We cannot have a referendum if we don't have Kenyan citizens, if they are dying in their large numbers. And I'm shocked that even Dr. Pamela is saying that death or no death, BBI must go on. Reggae can't be stopped. Does it mean that we have to dance on the graveyard of the COVID-19 victims? Let us be realistic as a country. We have a pandemic that is ravaging everything, including our economy. We can't afford our energies and our resources being channeled to something that is not of a priority.
I want us to move it and switch very slightly, even as we talk about marginalization and empowerment at this particular point in time, because even as we talk about COVID-19...
I think, Jeff, just a minute. Jeff...
Yes, Pamela, very quickly, go ahead.
This country is looking for is of such a priority in this country. And as Sankok sits there, I want him to know that even one of the nations that was really had it, America, still went ahead and had their elections. What we are saying is that we are not saying that the president should take all the money in Kenya and put it to BBI or the referendum or whatever it is. Let every money that has been designated for whatever role go to that role. And for that matter, the health sector Even yesterday, I was on air talking about the issue of our children returning to school. You know, right now, Kenyans seem to have forgotten that there are all other ministries that the members of parliament, including Sankok,
you can't compare Kenya with America,
various
my
parts
friend.
of money
No.
for certain functions
they have resources.
in this country.
We don't have resources.
So we want to see the Ministry of Water supply water in our schools. We want to see the Ministry of Health give us health workers in our
Where
schools.
is the budget?
We want to see the Ministry of Education give us educationists and the environment and the infrastructure in our schools. This is the Kenya that we must run. So I want us to veer off from this discussion of imagining that every single cent in the treasury is now going to referendum and there is no money put aside for anything else. This is misleading Kenyans, and it is blatant lie that we don't want to accept.
Okay, that has been got off the test.
Jeff, to also just finish on that topic by my honorable colleague. You know, Honorable Sankok is a member of parliament, and parliament is the one that appropriates funds for use in this country. So when it comes to national TV and start lamenting that money is being used, I don't know for what, he's lying to people, because the fact is that it is us as members of parliament who apportion money. Now, I want to see Sankok tomorrow in parliament trying to fight for money to be increased for the health docket, and then he shows us which area we are going to remove the money from. But you cannot just lament every day, because, you know, lamenting is very easy. But when you talk fact, people start raising eyebrows. So I wish to support that we are the ones who give money for the different activities of government. Let Sankok tell us where does he want us to take money from, and so that we can add money to the health docket, which we already have done.
We have 2 minutes
My friend,
before.
we have
Honorable
passed the budget.
Sankok,
We have passed the budget.
Second, please, Honorable
and there is
Sankok.
no budget
Sankok,
for BBI.
we need
there is
some
no
order.
budget
And that's why I am
referendum.
going, please.
And today,
Sankok, we'll mute your microphone, please. We need some order.
Today,
And that's why I'm going.
No,
Just one
today
second. I need to get back to Honorable Mboy on this.
Today, Health
Robert,
Committee.
I wanted to find out, because you have said it's Parliament that appropriates this money. As Parliament, do we know how much money has been given, for example, for the signature collection? Do we have that?
Now, I am also a strong supporter of the BBI process, but I will say this, that this process so far, where it has reached, I don't see the worry about issues to do with body, because collecting signatures is really not an expensive exercise. I will, for example, marshal my people in the constituency and try and get signatures for the BBI. And surely, if I was to tell you what it would cost me, I would say next to nothing, except my fear to go to the constituency, an opportunity to talk to the people. You know, people want to politicize everything. You want to make it look like it's going to cost billions. It is not going to cost anything. It's going to cost us very little, because going to the constituency and talking to the people is not an expensive exercise. I know health is expensive, and that's why we give most of the money, a lot of money, after education, I think we give to health. And we also devolve a lot of funds for health issues. So let's be real. I think the pandemic is being handled in the best possible manner, and this issue of BBI is a separate issue, and life, as we say, must go on. All these are problems we are facing as a nation, and all of them have to be dealt with.
Okay, I want us to go to our first break at this particular point in time.
You did ask
Sankok, Sankok, please. We're coming back after this break.
You did ask a question that I was supposed to ask.
But I need to go into a break. Sankok,
this exercise of collecting signatures is not very expensive. But remember, our kids need face masks, which is cost as little as 50 bob each. Is it not in order for Honorable Mbuyu to use the fuel that you will have used in his fuel guzzler, which will cost around 10,000, to buy 10,000 face masks for our kids? No.
That's all noted.
My friend.
I want us to go to our first break right here on the show. Clearly, BBI, quite a topic that generates quite a bit of political heat. Brings us to our first break. After the break, of course, we're talking about marginalization and empowerment, where is the question of youth, women, and people living with disabilities. Of course, that's coming up after the break. Don't forget, if you haven't gotten yourself a copy of your PD, right front and center of that is all about COVID realities striking home. You can get it straight to your phone. The number that you dial, *550 *4#. Once again, it's *550 *4#. Take a short break. We're back with more. This is K24 This Morning.